today matter be say get some things wey we dey see online. They pay me well. Our people like who go dey lie give them, especially when you hear say cure high, we get high blood pressure cure. So these things plenty online. You can't see our people. They come, they go buy them. They buy, they order. Say I want high blood pressure tea. Give me, make I drink, make it cure. And our people no say all these things. They proven. And you go they drink and you fit enter one chance. Now I come today, come beg you. Any medicine where you carry they put for mouth, you need to ask questions. Even the one where doctor we go tell you, say ask how much more. The one where they go package tell you say drink them, it go cure your BP. For now, BP never get cure. And many people they get stroke.
I bet doc, you go repeat that thing again. You say for now waiting.
For now today, so BP never get cure. But you feel control them. And many people they work out with high blood pressure. Next thing you go here say you don't get stroke. They go they blame one old woman for village or one old woman for community. Say na the woman, nine fire and arrow, now make can get stroke. But you no say na the BP where they inside your body since
now
you activate can cause you stroke. Now me I'll come beg you, if you go they buy anything where you see online, carry people for mouth. When problem sets, that little money within your pocket, it go leak through away.
We don't see situation Lagos, Nigeria, where be say person they sell all those mission, when be say all those women they like they gather the hawk. And by mistake, one of the coconut when she take mix the thing put, it can't pour for ground.
Yes.
So it can't pour on top of all those wood where they put in a construction site now. All those wood when we say get small irons, get more nail inside. So now we say the wood can begin the met. The way the wood stay they met because the chemical have been at the liquid, it pour. Now we say finally the men they were gather say they want buy.
Drink.
Now they call pause, call finally ask. Say madam, exactly which kind of herbs now you put inside this thing. So she got they turn around, they beat around the bush. Papa, this thing yes, and then the TT happen. This our via here. But they call they turn around, they beat around the bush. Cause say madam tell say I don't go yarrow day inside. They say you bring them out, bring the list of the things where you put. Say go help this way, go help that one. But with the look the wood they met. It be like say na corrosive acid and they pour on top.
And when they drink them, you can't say inside belly they hot. Now so somebody go drink.
He say if they hot, now me say they work.
Smart tell you life story. This one a life.
Real matter.
Somebody buy that thing, drink finish. The person enter admission for 2 different hospitals.
Jehovah.
This one no be them say them.
2 different hospitals.
2 different hospitals.
Hey.
Make I shock you pass.
Shock me.
The person travel enter Nigeria. The person never did Nigeria. Oh. He say he want to come and collect it. As he enter Nigeria, he come buy, come drink.
Wrong move.
For 1 month, this person no fit travel come out for Nigeria.
Wrong move.
It was very very bad. Now I go beg you again. If you dey buy anything put inside your mouth, make you know what you dey drink. Oh, some don't drink waka go. They no see mouth take talk their story.
Good Lord.
I dey beg you. So BP for now, it no get permanent cure, but you feel control am, you feel manage am. Don't let anybody come deceive you. Like I always talk, good life.
Na sense. Now everybody they talk and say BP na major thing when we say be importance when Nigerians need to look at, because post COVID they say one of the thing when we say increase for most people when we say COVID cash, whether you agree say cash or not cash you, na blood pressure. Am I right, doctor?
High blood pressure.
High blood pressure. And they talk say people when we say get a certain age before now they say that they get them back in the 90s. Say but not be so again no.
Be so...
Say you can see teenagers, you can see
young children carry high BP.
So now when you don't hear something like this and you dey feel some type of way, you when they listen, I go advise you make you put your ear down for the next few seconds. Make doctor break am down so that in case this now be waiting they worry you go know how to cash am quick before the thing go come cash you for where be say you no expect. Doc, wetin be blood pressure, high blood pressure, and why be say it important for even young people to even be aware now on how to manage it?
So we'll start with blood pressure. Normally, blood pressure. If you no get blood pressure, it means say you know they are alive. So you get blood pressure, you get normal blood pressure. As your blood they move for body, your blood get pressure. Those for organizer go tell you say as they pump tire, you know pressure. Now when the pressure for your body come high inside your blood, your arteries vein is high, you don't get high BP, high blood pressure. Waiting I go here, doctor, waiting they cause am. I don't know, they my family before. Yes, many things they will cause am. Some people the kind of life where they live, where they smoke, they take alcohol, they exercise, they chop nyama food, or you get them for your family if you dey, or you get other medical conditions, you get hormone problem, you get diabetes, even kidney problem, if it cause am. The most important thing wey I wan make you hear me this morning be say you fit carry am for body and you no go know. E go just dey inside your body, and I dey use this word, e go dey chop you small small. E dey chop your body, e dey chop you. Notice say because e no dey give you sign mean say you are okay o. As you wear suit or you gauge this morning, so everything dey okay, but you never check your BP, e go dey chop you, dey chop you, dey chop you small small. By the time wey e go come give you sign, you don carry stroke enter, or you don carry kidney problem enter, or you don come dey spoil the heart. And then some go come tell me say, doctor, I dey always get headache, or my eye dey always turn me, or anytime my eye dey turn me, e mean say my BP don high. If you dey wait to get sign say your BP don high, the problem don already dey go far. So now make I wan come beg you, before you start to dey allow problem enter, go check your BP. High BP fit no give you sign. As I talk am before, if it dey chop your body, go dey chop you dey go, you no go know. By the time you go know, if you don spoil your eye, if you don spoil your kidney, if you don spoil your heart, if you even knack you stroke. So no let am chop you. Go check your BP. Make we enter the question.
Okay, to the question. This one come as Favor from Shomolu. He say if person dey on a steady, let's say contraceptive like posting or 2, P2. He said that one fit get a side effect of causing high blood pressure for a young lady.
Favor, you won't carry us go where only you know. We know they talk about posting.
No, you say if
I know why.
Yes, medication.
I know why I'm posting not 2. You mentioned that exactly. First of all, you should not be touching it. Certain medications they where you know supposed to they take anyhow, because you take them anyhow, they fit give you BP problem. They fit give you also other medical problem.
So make it first of all avoid P2.
Leave P2 unless special criteria dey. No be say you go dey drink and like you dey drink vitamin C. If not, you go collect BP, you go collect many other things. Yeah.
Really?
Go collect many other problem. No be only BP you go collect.
Madu.
Even that one no be radio discussion, because many things dey we go break. That one fit be online discussion.
Madu.
So
this one comes, he say, good morning, Shiso and doctor. He say, I beg go, BP, they make body, they pay person, because I don't understand. This na Ben for Jusha.
Ben, BP no they really make body pain you. However, if body they pain you, if it be say other things the way they cause them, also if you check your BP, if you see say BP high, but no be say because body they pain you, you don't get BP.
Okay, this one say, okay, see me, I dey use electronic measurement they check my BP.
Okay.
But I dey see say it dey be between that 170 to 226. 226. No, 126. 111. 111.
Okay.
No, 117. Sorry, bros, no vex, make I take am again. 117 to 126 over 80. Is they okay? Now wetin they ask.
No bad. No bad.
What will be the standard number for person when we say you want it okay?
So no, the thing be say because BP get as be, we talk say me your BP no go high over above 120 over 80. Make you no pass that level. If you don't they pass, we don't they near 140 over. All those 140 over, probably don't they. So we know what make it go from that 140 go up. If you don't pass 120, you fit do some things, carry and come down. 120 over 80, 120 over 90, 126, 128, 132. You fit do some things, exercise, reduce salt, sleep well, stop to the smoke, leave alcohol alone, make your body feel enjoy. Leave all those things, BP go come down. Yeah.
So now they get some things on a feed do, especially if you be say you want maintain that 120 over 80 as a standard number for
if
your
you
BP.
see they less than that and you see they normal.
It's still there. Then which one might be the one where say if you too low past this one and their problem they too.
That's one people don't they ask I'm too much low blood pressure.
This one said, okay, good morning. No, I bet person when get high blood pressure. If they take blood tonic, this not from Shishi from Okeafo.
Chichi, yes, people they take blood tonic anyhow. If you know say you no get reason for blood tonic, why are you taking blood tonic? Blood tonic be say you won't build your blood. So you get problem with blood. If you no get problem, your blood no short, you no get problem with blood. What we go advise you be say chop your balanced diet, your multivitamins occasionally if you take them. But no be say you go just go dey drink blood tonic anyhow. Why? Why?
Oh, but not they take out too like say na vitamins. This one say analgesic can it cause analgesic can it cause blood pressure?
Oh my
That na
God.
Akpo for those of us who don't know what that one mean now.
Analgesic means body pain medicine.
Oh.
So you get how some people go abuse body pain medicine if it spoil their kidney. When it spoil kidney, if it can't give you problem with your BP. But that one a long process. So get some kind of certain medicine where people they drink for body pain. You they mix body pain medicine anyhow. Those mixing, fit scatter your kidney. When they scatter your kidney, you will get kidney problem, go get BP problem, go get other problems.
Nurse, give me this one. Nurse, give me that one.
Mix them. So now we could always beg you. If medical professional no carry medicine give you, no just open your mouth, they drink them anyhow.
Okay, but let's say today na about WhatsApp people well because the message is they pass over 20. So more than no verse. This was say Godwin for Ikorodu. He said God, doctor and everyone good evening, have been a good morning. He said how many times person supposed to check blood pressure regularly?
Godwin.
Every morning I've been 90.
Okay, very good question. First of all, if you no get BP problem, maybe once in a month. If you no get BP problem once in a month, then you check. But if you get BP problem, and depending on how your BP don't come high and waiting then can't tell you, then go determine how often you go to check your BP. You understand? But if you no get BP problem before, if you check am once in a month, you move on. They check, they monitor, because one day if you just, or if you get person for your family we get BP before, you need to put eye.
So you inherit BP for your family?
Yes.
Mama
if
get
your
BP,
mama get
grandpa
your papa get them. Put close eye for your own BP.
Oh, okay. This one said, okay, my sugar level this morning now 111. Is it low or is it okay?
Your sugar level is not bad, but so concerning sugar right now, there are many things to know about sugar. Now, random sugar, I mean, fasting. You understand? So what I mean by fasting, you never chop, you don't do after you chop. So those things will really help.
Okay.
So I go advise you want to check your sugar, check in the morning when you never chop. It will help your doctor decide very well.
Okay. This one say, I don't understand this touchlight thing. Oh, okay. Say if you are somebody that is very sexually active, if they give you blood pressure.
No carry me go where I don't know.
Not me.
Frankly,
from Maza, I ask the question,
Chief,
not me.
Frankly, no carry me go where I don't know this morning. Leave me. I did studio. I beg you. Let's not go there today.
Let me say not go there. 0700951951951. We'll get time for just one caller. Make am short, sweet, and nice. Who be that? Okay, reduce your radio. Make you ask your question. 30 seconds.
Hello?
Okay, yes. Doctor, they listen.
Hello?
Kiro. Oh, Matters.
Yeah.
Please, is there what you can help us to tell us to do in that low blood pressure before going for test?
Okay. See, I tell you, say we go table this thing Thursday. We not get choice.
Okay, we'll talk about Thursday. But it's very, very special. First of all, video day. People need to know specific thing about low blood pressure. So the video day online, if you watch them even before Thursday, so that you could get so many questions. And stop panicking about low blood pressure. Allow only a medical professional to diagnose you so you get low blood pressure. Not even chemist fit diagnose you so you get low
my
BP.
nurse friend.
No,
my daughter.
No, be even chemist fit diagnose you of low blood pressure. Allow only a medical professional, only a medical doctor fit really confirm say your BP is low, really low, and need medical intervention.
You never download the Wazobia FM app? Chai! You dey miss wella. Oh yeah, download our Wazobia FM app today on top Apple Store and Google Play Store. Make you fit listen anywhere and everywhere. Join the Chukmat family today.
Wazobia FM 95.1.
Chukmat.